Josh, before you go, I wanted to get your impression on what the presidential candidates have been saying about the healthcare issue. I mean, we know that they're both promised to leave Medicare alone, or, at least I guess that's about the way they put it. So, um, but how they're discussing healthcare in general, there's some big distinctions or things that they should be talking about that they're not talking about.
Yeah, I mean, the one thing that neither of them are talking about are really about lowering costs for the healthcare system in general. And I think some of that is in the commercial insurance space, and some of that is in our government provided health insurance. And I mean, I think the government provided health insurance part is really a good example of all of the things that the candidates should be talking about, because there are two real big issues that are going to come up in the next presidential term. The first is that you have all of the tax cuts expiring, and you also have the extension of the Affordable Care Act subsidies that are expiring in 2025, and how the candidates want to deal with that going forward will have a big impact on the budget, a big impact on other health insurance programs, and certainly the number of people who have access to health insurance. So extension of those subsidies is going to cost something like $300 billion over the budget window, and is how things come out of that negotiation, and I'm sure it'll be part of all of the tax cuts. That negotiation is going to really go a long way towards figuring out both how many people have access to this government insurance and how much it's going to cost the government. Hopefully, they will at least pay for any extension of those subsidies. There are a lot of ways to make that extension cost less, but still get almost as much insurance to people. So hopefully they will reform that a little bit and not have it be a hit to the federal budget. And then the other issue, which you kind of brought up, is that both campaigns have said they will not touch Medicare. And you're actually starting to see the campaigns hit each other for proposals that did touch Medicare. And I think this is simply arguing about a distinction that is very dangerous and problematic. There is a difference between cutting benefits for seniors already on Medicare and the amount they have to pay for their healthcare and the amount that government is paying to give them health insurance, and how we're going to lower costs in Medicare to pay hospitals differently or less, to pay doctors differently or less, to pay drug companies differently or less. And all of the proposals that I work on in the Health Savers Initiative, and actually the Obama administration and the Trump administration had proposals in their budgets to reduce costs in Medicare in ways that would actually make the benefit better for Medicare beneficiaries by lowering their out-of-pocket costs or lowering their premiums. And we can do both of those things at the same time. And if the Trump administration proposes to pay hospitals differently, to where we're sending less money to hospitals and premiums go down, that is not a cut to Medicare, because Medicare beneficiaries are actually benefiting from those reductions. Similarly, when the Biden administration negotiates lower drug prices and premiums get lower and out-of-pocket costs are capped for seniors, that does not mean they've cut Medicare in the way that some of these political attack ads suggest. So my hope is we stop attacking each other for reducing costs in the Medicare program in ways that make seniors better off. Because if we even make those cost reductions off limits and subject to political attack, we will never be able to lower healthcare costs in the United States, either for the federal budget or in the commercial market. So that is my sincere hope for this campaign, that we stop counting budget reductions that the CBO says will happen in Medicare to scary cuts to seniors' benefits.